And sort of one sort of final piece of the puzzle here is, any rural hospital, you're going to have a fair amount of, patients that are either on Medicare and have a coinsurance, but don't have a secondary, or you've got folks that are on Medicaid or Medicaid eligible that's going to pay an offset, and then you've got a number of folks who actually do have a balance, but the tools that are available that these folks are using are not making it easy for sort of modern patient payment, credit card payment plan, one-click access. They're still sending paper statements and nothing electronic, and they're still collecting with a check in the mail, and they're making it as painful as possible. So there's another area where you've got to make it easier for patients to give you money. There's a variety of tools out there that can do that and that you can use to stay in touch with patients about their balance as early as possible. And then, of course, the front end process of, in a situation where you can estimate patient responsibility, you need to do that at the time of service and let them know, and ideally at least get a down payment towards that, or a credit card on file that you can bill towards that, or a care credit or whatever it might be that you're going to use to collect as early as possible, because we see this all the time. Folks aren't getting a statement for 6 months, and people just don't pay when it's that far in the past. If they had just changed the process on the front end, they would have gotten paid, or they could collect a payment plan of $100 a month. Even if we don't 100% know what the final balance is going to be, we know it's going to be $1,000+, some subset of your deductible. And we want to be able to collect that. And so folks have got to get serious about collecting patient responsibility and making it super easy and modern to do that.
Yeah, and I'll have to throw in the nuances of a small community, John. Oftentimes, you try to collect from, Miss Susie, and she says, "Oh, Dr. Smith knows me. I've been paying $10 a month for 2 years. I'll just keep doing what I can do," and that's legit, right? That's legit. But just the idea that people know each other, they're very tight knit in the community, and it kind of it puts up another layer of burden on the person that's trying to collect. Like, I know her. I know that her husband just died, 3 months ago. I just had to throw in there the personal aspect of it, the personal level in a small community. And how do you manage that?
Yeah. You don't want to be sending people to collections out of the gate, being insensitive. And this is where I think, things like facilitating payment plans, making it really easy, and even the suggested best option is going to help. You can make this easier on folks. Yep. Well, we've covered a lot of tactics. We're in bed working with rural hospitals, implementing Lockbox to find new money, clean up bad debt, clean up bad AR, and help stay on top of the ongoing AR, and adding automation, helping them work with vendors, kind of doing a lot of things to make rural hospitals successful in their revenue cycle department. Stop feeling like they're just almost drowning, at least get their head above water, and control the situation. So we're excited to do more of that for more folks. If you're having challenges, any of the types we've talked about, we'd love to talk to you.